Fibromyalgia. Symptoms of fibromyalgia: headache, pain, seasonal affective disorder, TMJ syndrome, pain, irritable bowel syndrome, pain, interstitial cystitis, vulvar vestibulitis, vulvodynia, urethral syndrome, obviously pain, cognitive difficulties, ear, nose, and throat problems, vestibular complaints or vertigo, multiple chemical sensitivities or allergies, postural hypotension or mitral valve problems, chest pain from anxiety, etc., and patches of paresthesia throughout the arms and legs that are not consistent with any one single nerve. Cycle of fibromyalgia. This is one of the things that are known, and again, this kind of feeds into what we're going to talk about here going forward in a little bit. But initially starts what a lot of people think with sleep difficulties. When you have sleep difficulties, most of the time those are from very specific imbalances in certain brain chemicals called neurotransmitters. Those, one of the most powerful ones is serotonin. Serotonin is converted into what most people recognize, which is melatonin. And most people are aware that melatonin is required for sleep. If you don't get serotonin or enough serotonin production in the body, you can't make melatonin, and hence you can't sleep very good. You can't get into the deeper stages of sleep throughout the night. With serotonin, the best way to replete it in the body is to take its immediate amino acid precursor, which is 5-HTP. And that's an easy way to get that back up. And there are certain products out there that are specifically designed for sleep. One of them that I have in here, I think, has both serotonin, or 5-HTP, and melatonin combined. So you get the end product and the precursor to allow your body to make it on its own. And that's kind of one thing I think is important too to mention, is that whether, and I think I mention this pretty much every time I speak, is I don't care whether you're taking something naturally or conventionally, medication or herb, nutrient, amino acid, whatever it is. If you're staying on something forever externally, at some point there's going to be no impetus for your body to make it on its own. So whenever we try to start working with somebody, our end goal is that that person can be managing that problem successfully or preventing it from recurring on their own with food-based regimens as much as possible, rather than continuing to have to take 40, 50, 60 pills every day. Even if they're natural supplements, obviously, A, who wants to take exorbitant amounts of pills forever and ever and ever, and B, who has the money to pay for that? I wouldn't do that, so I certainly wouldn't put any of my patients on. So, I mean, there are certain things that people will have to indefinitely take, but those should be the exception, not the rule. So. Also known, as far as sleep disturbances go, adrenal function, again, stress hormones. The reason being, the adrenaline hormones actually create other hormone problems. They create progesterone problems and they create estrogen problems. And if you don't have enough progesterone, guess what? You can't fall asleep. And if you don't have enough estrogen, guess what? You can't stay asleep. And so a lot of people who have hormone problems also will develop fibromyalgia until they go on some type of hormone replacement, and holy cow, I feel a lot better. Even if it's only temporary. Because you still have to find the cause of that hormone deficiency in the first place. Otherwise, you're still not, fixing the problem. So obviously, if a person can't sleep, at some point they're going to become exhausted, right? Question.
How about shift workers?
Shift workers are tricky. Graveyard shift, third shift, that's very difficult. You have to change the way you read their labs, and you also have to invert the way they supplement certain things, certain hormones.
The typical sleep clinic doesn't seem to involve themselves in this at all, apparently. I visited one time and didn't get nowhere, just one session.
I'm not really familiar with it. I mean, we only send if there's a concern of sleep apnea, but that's the only time we send to sleep clinic, so I'm not really familiar with what exactly all they're checking, other than to.
I mean, we got these people on third shift, they got staff on night, they don't have any support groups, nothing, huh?
I agree, it's very overlooked because very difficult to treat because your body is not designed to stay awake all night. Our body is designed to go down when the sun goes down. And to work antithetically to that, it's very difficult to work with for a long period of time. At some point, obviously people who can't sleep become tired. And obviously when you can't sleep and you can't recover, you start to develop other things. Decreased energy. You're probably going to exercise less because you're tired. You're exercising and moving less, so you're going to stiffen up. You will start to have muscle atrophy, joint degeneration, and increased pain. To put this another way, on a microscopic level, if you immobilize any joint in your body, I don't care if it's a joint in your spine or a joint in your big toe, if you immobilize a joint for 2 hours, that joint under a microscope will start to degenerate. Joints are designed to move. If you don't move them, they will become arthritic fast, period. And the problem is, again, when you're tired, you don't want to move, and I get that. So we have to get these people sleeping as best as we can, as fast as we can. And of course, now when you have this joint immobility and pain and stiffening, we create other inflammatory responses to that pain, which then obviously hurt and make you also not want to sleep more. And the problem is a lot of these can be affected, can be intensified at nighttime because you're not sleeping. And your body never has a chance to repair these on its own. Also, once we get to a point where these inflammatory chemicals are being produced, it takes very specific anti-inflammatory chemicals to get these to go away through tissue repair, which tissue repair only happens here. So if you never get tissue repair, you can never get inflammation to go away. That's as bottom line as you can make it. In fact, a year and a half ago, Dr. Strocker and I went to a conference in Kentucky where one of the entire presentations was on how the whole process of inflammation in reality is nothing more than an ongoing inability of the body to repair certain injured tissue. And once you can repair that tissue and give the body what it needs to repair that tissue fully, the inflammation goes away on its own. And so kind of a different version of looking at it in terms of saying, well, inflammation is just this random event that happens if you eat bad food, don't exercise, etc., which that's true. But at the same time, that doesn't account for everybody who is still leading a pretty good lifestyle, doesn't eat, especially if they've already made a lot of changes in their lives because they've had these things in the past. But now, even despite the fact that they're living clean and living pretty well, they're still having a lot of their symptoms and they don't improve. And a lot of that, again, is just getting them to identify what's injured, what's left to repair, and get that to repair. Oh, yes.